And talk about attachment too, right? Obviously, that is oftentimes talking about attachment injuries, right? Attachment injuries are typically times that you are expecting your attachment figure to show up for you, right? Be there for you, that you can trust, right? But when somehow they have disappointed you, betrayed you, right, hurt you, that's an injury, right? And most addiction behavior typically would threaten our secure attachment with our partners, right? Though, but it's not always the case, right? I don't want to say it's always the case. I mean, I've some work with some couples, even though the guy was caught in an affair, or sometimes even was caught in some kind of sex addiction, watching porn or something like that. But for some partner, this isn't a big of a deal, right? The expression of it. Because they know it's a isolated incident, is a one-time thing, it's a one-nighter, you know, whatever it may be, right? So that the injury wasn't as loud. But most of the cases, though, right, that I came across, especially because they come to us to see us for help, right? Usually, I do see that as the injury is much very apparent, right? Sex addiction behavior typically do threaten secure attachment and create those injuries. The sex addict, right? Typically, we hear like a lot of shame, guilt, the fear of failure is loud. For the injured partner, right? The injury is around the betrayal, right? And then also, it's not so much about just the betrayal. It's about the meaning making that they make about like themselves. How come you will go to the porn and not come to me? Like I'm here, I'm available. How come you don't come to me? Or must be about me. I'm not enough. Something about me that you don't really particularly want, right? So that causes a lot of shame and feeling isolated and whatnot, right? In order to heal, I mean, it's important to create attachment safety, right, between the two partners in couples work, right? And EFT is especially helpful in that area. That our centerpiece is around creating safe and attachment. We don't particularly work a lot with behavior per se, right? But we want to go in and able to help people to reconnect. We help people to be honest about what the hurts are and invite the other partner to come and able to soothe, to provide empathy and comfort, right? That's the antidote, right, for the injury itself. Because you can't psychoeducation someone out of the injury, the pain. You can't teach people try to logic your way through that. The Sue Johnson said it best, I think. She says the best antidote for one's pain is actually that secure emotional attachment. Your partners are the best regulator of you, right? When I'm in pain, when I'm hurting, my partner is going to be so helpful to regulate that pain. When she can help me to do that, or when he can help me to do that, usually that's when I also can feel more confident, more secure, right? And that's when also I can self-soothe and comfort myself, right? If you know anything about attachment theory, that's what it says, right? When you help kids to feel safe, right? They can come to you with their fear, their sadness, their hurt. And when parents can show up and be there, be present, and can comfort them, it actually helps them to become more independent, right? It actually helps them to be able to self-soothe themselves. And then the more they can do that, the more they also feel secure in relationship. Okay.